Hi, we want to welcome you all to the first webinar in a series offering mental health and suicide prevention information, support, and resources in response to the global pandemic. I'm Kelsey Schmitz. I work for the University of Washington at the School Mental Health Assessment Research and Training Center, or the SMART Center, as the School Mental Health Lead to the Northwest Mental Health Technology Transfer Center. Our center is located in Seattle, but I'm joining you from my home office slash home school in Olympia, Washington. Usually our webinar production takes a few months to put together, but with the help of several people, we have put this together in about a week, which is a record time for you. We're all adapting to this new normal. The global pandemic has changed our jobs, our homes, our kids' schooling. Every parent is trying to adjust to manage their changed work situation and changed home situation. In response to these critical needs, a group of organizations based in the Northwest region have quickly formed an alliance to join together and co-develop, co-deliver, and co-sponsor content, resources, and other information for you. In an effort to bring together in one spot a wealth of information relevant to school mental health, the Northwest Mental Health Technology Transfer Center, the UW Smart Center, are partnering with Forefront Suicide Prevention Center, Northwest Positive Behavioral Interventions and Supports Network, Well Educator LLC, and others to bring you this well-being series. Our center, the Northwest Mental Health Technology Transfer Center, is a SAMHSA-funded center, the Substance Abuse Mental Health Services Administration. And because of that, we want to share the disclaimer that these views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for the Mental Health Services, the Substance Abuse Mental Health Services Administration, or the U.S. Department of Health and Human Services. So I mentioned the Wellbeing Series is something we are putting on collaboratively with several other Northwest organizations. We welcome you to join the rest of the series. You can follow that link that is on the screen, and I think will be available for you in the chat box. You can go to that link and find registration links, recordings, presentation materials. We are also continuing to update the Wellbeing Series. If you have any questions, you can email my colleague, Megan Lucy, at mlucy@uw.edu. And then just quickly, the Mental Health Technology Transfer Center, again, was funded by SAMHSA in 2018 and includes 10 regional centers, a National American Indian and Alaska Native Center, a National Hispanic and Latino Center, and a network coordinating office. Our Northwest Mental Health Technology Transfer Center region supports the states of Alaska, Oregon, Washington, and Idaho. We are part of the network that spans across the United States, and we recognize that we have folks joining us today from all over the United States, and want you to know and be aware that in your region, you do have your own mental health technology transfer center. But what's fantastic about this network is that we welcome you to join each of our centers and to access all of our resources and trainings, materials, and other things that might help support your mental health needs. So you can contact us at the Northwest Mental Health Technology Transfer Center. We're part of the School Mental Health Supplement. Myself and my program coordinator, Megan Lucy, our emails are posted there. You can reach us by phone, by website. You can also sign up for our newsletter, which I would highly encourage. We will be sending out notices of the Wellbeing Series through that newsletter, as well as letting you know when things are posted. You are also welcome to follow us on social media as well. Finally, if you haven't completed the pre-survey, please do so now. There is a link that will be in the chat box that will allow you to follow that link and take that pre-survey. It should just take you a few moments, and the next slides are introductory. So if you haven't done that, we encourage you to do that. If you take that pre-survey and the post-survey that we will be providing you the link for at the end, you will receive a $5 Amazon gift certificate. If you complete a survey 2 weeks following, you will also receive another $5 Amazon gift certificate. So at this point, I want to hand it over to Dr. Jennifer Stuber.
Good morning, everyone. I'm so appreciative of your being here today. Today we will be presenting Learn Saves Lives, brought to you by Forefront Suicide Prevention. I'd like to introduce my colleague, who I'll be co-presenting with today. His name is Dr. Chris DeCou, and he's in the shadows there, but he's anything but a guy who lives in the shadows in his real life. Dr. Chris DeCou is assistant professor at the Harborview Injury Prevention and Research Center at the UW. He is also affiliated with the Center for Suicide Prevention and Recovery at UW Medicine, and he works a heck of a lot with Forefront Suicide Prevention as well. He's a fantastic human. He helps people who are at risk for suicide in the clinic. He is an encyclopedia of knowledge around everything around suicide prevention, and I'm just pleased that he's able to join us today. He's a great collaborator and friend.
Thanks, Jen. And I'm so thrilled to be joining Jen to present to everyone today. Dr. Jennifer Stuber is an associate professor of social work at the UW School of Social Work and is also the co-founder and director of Forefront Suicide Prevention. And for those who may not be super familiar with what Forefront has been up to, Jen's work via Forefront is really given a model of innovative and effective suicide prevention really for the nation in terms of some of the stuff that's happening in Washington, including this training, which really will integrate a lot of different things that have been found to be useful to lots of folks to really wrap their minds around this important and sometimes kind of difficult to think about topic.
Thank you. Just say a tiny bit more about Forefront. Our mission statement is that we're focused on reducing suicide by empowering individuals and communities to take sustainable action, championing systemic change, and restoring hope. And we very much welcome volunteers and see the work that needs to happen in suicide prevention as really a grassroots movement. Okay, so why are we here? So the training we'll be presenting today is truly relevant, I believe, for everybody. Suicide prevention training needs to be as common as CPR. So this is training that's really relevant for anybody, anytime. However, with the COVID-19 pandemic that's upon us, I also think that there's the potential for us to have an increase in suicide rates. While there is not clear data on that, the possibility of suicide rates increasing yet, and nor do I hope there is an increase in suicide. Obviously, there are reasons for concern. The economic downturn can sometimes lead to increases in suicide rates. That's been shown historically. As well, we're seeing an increase in prescriptions and more medications in people's homes because they're not going into the clinic to refill prescriptions, and people are stocking up on over-the-counter meds. We have an increase in firearm purchases at this time, and so these provide easy means for families to access. The disconnection, to the extent that we're fostering disconnection instead of connection, which is, I think, something we have control over, that disconnection can also be a risk factor for suicide. So, there's some concern that we may have an increase in suicide risk, particularly in this time. And so some of what we'll be talking about today is how do we make sure we're in front of that curve so we don't need to flatten it. And so that's why I'm especially glad that you're tuning in this morning. So here's an overview of what we'll be doing during the training. We're going to talk about suicide in the United States and amongst our youth and kind of give you an overview of the problem of what suicide is and isn't. We're going to be talking to you about how you can help and things you can do today. And then at the end of that, we're going to have an opportunity for you all to ask questions that related to the content of this presentation as well. So we would like to make this a bit as interactive as possible. Obviously, this is not the same as if you were in a classroom and we were presenting this material, but we do want you to participate in some interactive exercises with us so you can stay more engaged and focused. So let's just start out with 4 true, false polling questions. So what you're going to see in a moment is that these questions are going to pop up pop up on your screen, and you're just going to answer true or false. What do you think? And then we'll review the answers that you submitted together. So for true or false, suicide affects all communities. Wow. I'm going to share these results. I just want to say we got 100% with the saying true, which is the correct answer. And so we must have a bunch of really brilliant people on this webinar. Next question. Many suicides are preventable. And indeed, this is also true. And we've got most people, 98% of people on this webinar indicating that they believe that many suicides are preventable. Next question. Asking about suicide. Asking about suicide does not cause suicide. So here we have 96% affirming that that is true, that in fact you can ask about suicide without it causing suicide. And in fact, we'll talk more about that in the training, but that's a common myth that if you ask about suicide, it causes suicide. And that is absolutely not the case. Asking about suicide does not cause suicide. Last question. Suicide is the result of multiple complex factors. Okay, so I'm getting 95% of people saying that that is true, and indeed it is true, that suicide is the result of multiple complex factors. What we often hear in news media is a simple story of someone having some kind of catastrophic event in their life happen, like a divorce, or maybe being arrested for driving while intoxicated, or losing a job as a triggering event. And those events are important, but the reasons underlying someone getting to a place of thinking about suicide as a result of those kinds of life events are much more complex and usually tied into a deeper history around mental health challenges and substance use disorders. Okay, so let's move forward. This webinar today, so thank you all for participating in that poll. You guys are clearly with me and thinking very thoughtfully about your answers. So this webinar today will cover emotionally challenging topic. If you've had any experience with suicide in your past, it may trigger some big feelings for you to learn more about suicide and how to prevent it. I just want to say that I think that that's actually ultimately having those kinds of thoughts is actually part of one's healing process around suicide. But I don't want to mitigate the fact that some of this material may cause distress for those of you who may have had suicidal thoughts. So I'm going to ask that if you've had, some kind of triggering event related to this video, that you talk to someone you trust about it at the end of it. And then also tonight, you may be a little bit more tired than usual. Maybe this is a good night to take that bubble bath or do something special for yourself at home. And we're going to be talking about content, and unfortunately, it won't be as interactive as it normally is. So we're going to encourage you to practice some of what you're learning today with family members and those with whom you are physically interacting with at this time. And if you can, avoid multitasking during this presentation, because what could be more important than taking the time to learn how to save a life? Okay, so why are we here? This is that overview section I was talking to you about. Why are we here? Well, because even before COVID-19 started, we have a mental health emergency amongst our young people that is occurring. Suicide is the second leading cause of death for those who are aged 15 to 24 years old. And what I want to say is that even though it's the second leading cause of death, in fact, in terms of, I think of it as actually the leading cause of death, because the leading cause of death, as compiled by the Centers for Disease Control and Prevention, is all accidents combined. So suicide is actually the leading cause of death if you don't combine all accidents. So, for example, suicide is more common than traffic fatalities for our young people today. In 2018, 17 young people died every single day from suicide. So think about that. That's not a small number. This is truly a public health emergency. And for every suicide, there are approximately 25 attempts. And so what I want you to understand is that suicide, you can imagine an iceberg. Take a minute to close your eyes and imagine an iceberg. Suicide deaths are the tip of that iceberg. But underneath that waterline, there are many, many opportunities for prevention because suicide attempts happen before suicides. And people start thinking about suicide before suicide. And oftentimes, many of the risk factors, like mental health disorders and substance use disorders, they are there and present for longer periods of time before suicide. So there's so many opportunities for prevention. So those are national data that I showed you. I'm just going to give you a snapshot of our state of Washington, where this is being broadcast from. We do a healthy use survey every couple of years in our state to look at the state of mental health and physical health of our students. So these are data from 2018 showing that we have 45% of eighth graders not reporting that they're not being able to stop or control their worrying. 40% of 10th graders feeling sad or hopeless 2 weeks in a row, and 18% of 12th graders plan. So that the issue that we're dealing with today is not a rare event. It's something that we all really do need to be prepared to help prevent. This is, again, these are the precursors, the kinds of signs you see before someone actually attempts or ends their life by suicide. So some of you who are on this webinar are parents, some of you are educators. Whatever brings you here today, I'm just going to talk a little bit about your role as a parent in suicide prevention. Well, when I say parent, I also want to encompass foster parents, other caregivers, but basically, you all have an incredibly important role in terms of taking care of yourselves so that you can provide good role modeling for your kids around mental health and well-being. But you also have a critical role in connecting with your young people, and especially during COVID-19, you have a very important role in that connection with them and identifying if they are in need of additional support and helping to advocate for that support, as well as keeping your own home safer all the time to prevent suicide. So let me take a moment to talk about what suicide is about and what it's not about. So what suicide is about, it's really when one's ability to cope with what's happening in their lives becomes too big, too overwhelming, too hopeless for them to handle. So that when that pain and that hopelessness, basically the scale is tipped towards pain and hopelessness as opposed to one's ability to cope. And that's a very simplistic way to describe it, but I just want you to understand that suicide is about pain and hopelessness. It's not about trying to leave this world. I mean, in fact, people who are suicidal, they think of suicidal thoughts are like a way to cope in a way. Obviously, a very not a very positive, a very negative coping skill, but a negative coping strategy to deal with the pain and hopelessness that they don't feel is going to come to an end. So people who are suicidal are not selfish in the sense that they are feeling pain and they also feel like they're a tremendous burden to those around them. And so they're also like, they don't feel like their life is worth living or that they have any much self-worth. And so it's really important to understand that people who are thinking about suicide, they're in a pretty difficult emotional state, and it's hard for them to reach out for help, which is why as a parent, a caregiver, an educator, it's very, very critical that we become more proactive in helping those who are worried about to help reduce their risk. So bearing in mind that suicide is about pain and about wanting to end pain due to hopelessness, I'd like to take a moment to ask you to consider some of our common language around this subject matter. Very commonly, people will say, such and such committed suicide. Committed is a word that does have a few positive connotations, but also has many negative connotations. Those connotations ranging from committing a sin to committing a crime. And what we're trying to do is help people understand what suicide is about, which is about pain and hopelessness, not about doing something bad or shirking one's responsibility. So let's make a concerted effort to strike the phrase committed suicide from our vocabulary. Instead say, died by suicide or took their own life. And this is a very important message we're also trying to get out to folks who are writing for the media or speaking on the media. So again, I would say my friend John died by suicide, or my husband, he took his own life. So today we're going to be covering what we believe everybody needs to know to help prevent suicide. Here at Forefront, there's an acronym that we use to help the public to remember these vital life-saving steps. Learn is the word that, is the acronym, and it stands for L stands for look for signs, E stands for empathize and listen, A stands for ask about suicide, R stands for remove the danger, and N stands for next steps. So we'll be talking about all this with you this morning. And I'm going to turn this over now to my colleague, Krista Koo, who's going to cover the L step in Learn.
So like Jen said, there's this really helpful acronym to organize your thinking and what you can do to help someone who might be at risk of dying by suicide. So L being the first step, look for signs, is really all about how do you know that someone might be in trouble? How do you know that there's some action that you ought to take or consider taking? So we've got this broken down into a few categories of types of warning signs. And you'll see that some of this feels very intuitive, but I'll maybe sharpen up a couple of these points in terms of where you might think a little bit differently than you otherwise would. So the first one here is emotions. Everyone has perhaps felt an intense emotion that they've been kind of stuck in. And if you could imagine, for people who become suicidal, sometimes those emotions are so powerful, so potent that it kind of crowds out everything else that might matter in life, where dying by suicide can sometimes feel like the only reasonable option. And like Jen was saying earlier, it's not that someone inherently wishes to die without any wish to live. It's that things have been crowded out, things have been truncated, and emotions are a big part of that. So you can read these that are on the screen, but just to point out a couple things. The first one there, agitation. I don't know if folks have thought too much about this as an emotion before, but this one's a little bit different than how we typically use the word agitation as being like upset, where agitation is explicitly referring to you have this like itchy feeling in your muscles, the sense that you must do something, even if you're not quite sure what that is. This is often something that people who are at risk of suicide experience. Most of my patients that I see in outpatient therapy either have made a suicide attempt or have seriously thought about it. This is a big part of it, that sense of urgency that I got to do something. So that's one to pay attention to that might stand out a little bit more than some of the other ones you may have thought of. Again, going down the list here, these are the negative emotions we all experience to some extent. And I encourage you to think about how some of these are incredibly deep emotions, like shame and humiliation in particular. And this issue of hopelessness, the idea that things are never, ever going to get better no matter what you do. Again, it's important to imagine that lots of people feel loneliness. Many people feel anxiety. Perhaps most of us on this call this morning feel some anxiety about how things are. The key is that you've got to understand what it is in particular for an individual that makes that a risk factor for suicide, makes it something that's driving them towards suicide. And we'll give you some tools and some of the other steps for how to deal with that. So in addition to emotions, it's important to think about how there are things people do that demonstrate risk. There's a few here that you've probably heard of before. And I'll just point out that, essentially you could imagine as someone draws back into that suicidal state, what some people call the suicidal mode, you can really see sometimes some pretty significant changes. A few that I'll point out just because they are really important. There are fairly overt, fairly severe things people do, such as cutting or hurting themselves, that are clear warning signs of suicide that need to be taken seriously. Those are things to look out for. Another one that you may or may not have thought of, especially if you have adolescents in your household, reckless behavior, and not just sort of these, really important expressions of impulsivity and experimenting with social roles that you would see for adolescents in general. But this is where you see that someone really has lost that, not just that fear of death, but really seems to have some indifference about whether they live or die in particular situations. And then one of these that's become particularly important in recent years and a growing area of scholarship really is this issue of looking up stuff on the internet. And so I've done a fair amount of work with, schools with from elementary up through high school, and it's remarkable to see that even children as young as 6 or 7, with some of the different apps that have a social interaction function, or anyone who's got access to a search engine, you can see some remarkable internet searches. People looking essentially for ways to kill themselves that are not painful, ways that are readily available. And so this is, something to really be mindful of, and one that increasingly is both problematic, but also is accessible if you're able to monitor that to some extent. And that goes right along then with what probably stands out to me as some of the most important signs that are the most clear signs, but often overlooked, which are ways that people, say directly to someone that they are thinking of hurting or killing themselves on purpose. Um, I would ask this question if folks could answer my questions live here, but I would, ask you to wonder about, has there ever been someone in your life where, they said they were going to do something and they talked about it for years, and it was hard to take them seriously because you got fatigued of someone saying, I'm going to do this or I'm going to do that again and again and again for many years. And this does come up with suicidal communications, with people saying, I should just end it all. I'm so sick of this. Why, I have no reason to live. Increasingly, we see this show up on social media, which is of particular relevance for youth. And the important piece here is there's been a lot of studies done where something like 78% or more of people who die by suicide told someone else explicitly beforehand. And so even if it is objectively difficult and fatiguing and sometimes tough to respond to everything that comes up, especially if someone does this kind of thing repeatedly, it's important to remember that to the extent you can, find support to take it seriously and to do something about it. And one way that I think about this is if I were to, have a discussion with everyone here and say, tell me about the place in the world that's far away that after COVID-19 is, after those restrictions are eased, that you'd like to go on vacation for 6 weeks at some kind of luxury resort, you would probably tell me, so for me, it would be, I'd want to go to Italy for like 6 weeks and just hang out. And I might actually tell all my friends for years and years and years that, oh, I'm going to go to Italy. I really want to go. One thing they could do is they could say, oh, Chris isn't serious. He doesn't really want to go to Italy because he's never done it. Chris has talked about going on vacation to Italy for like years and never, ever got close to going. And so if we were talking about it, I would say, what are the reasons that I haven't gone to Italy for 6 weeks and won't be going anytime soon? And it would be that I don't have the time and money to do so, right? I can't bail on work for 6 weeks. It's a question of resources, not intent. And so I encourage you to think about suicide a little bit in this way, which is even people who repeatedly make threats or talk about suicide and have never done it, have never followed through with it. This may not mean that they don't intend to do it. It may mean that they lack the resources to do so. And it is a humbling and sobering thing how often, I come across cases where someone has died by suicide after having told people for a period of years, because it's tough to hang in there for many years when someone is saying the same thing again and again. And then the last piece here that I'll raise in terms of looking for signs, people have lots of experiences that can put them at risk of suicide, especially if you think about experiences that are physically or psychologically painful. So this would be any kind of trauma, abuse, or neglect. It certainly would include if someone has tried to kill themselves before, that puts them at risk in the future. So in general, just as a sort of overall guideline, if someone has tried to kill themselves in the past, that plus any one of these other signs we've talked about puts them at kind of moderate risk. And moderate risk means you have to do something like these learned steps we're talking about this morning. And just so in addition to things that have happened to people, particularly traumatic things, past suicidal behaviors, I also wanted to note that, there is this issue of different sociocultural groups have different rates of suicide. One identity status that's particularly important to consider for youth is that we do see much higher rates of suicidal thoughts and behavior among LGBTQ plus youth. And I've done some research in this area, and I think the key thing to remember is that that's an important thing to consider, but then to remember that it's not that being a certain identity inherently increases your risk. There's nothing pathologic about being a member of a certain group. It's the fact that some groups experience highly disproportionate rates of stigma, prejudice, discrimination, bullying, So I encourage you, when you think of these identity-based kind of signs of suicide or risk factors, that you really are using that as the cue and the signal to think, why would it be that a member of a sexual or gender minority group would have higher rates? And how do I look for those signs and really engage around those signs? And then the other thing just to consider, just one more point to make about prior suicidal behavior. A lot of times, people wonder, well, does that include non-suicidal self-injurious behaviors like cutting or burning, for example? Fascinating work from a colleague of mine, David Klonsky, where the only significant and strongest predictor of young adult suicide when they did this big statistical model was actually adolescent non-suicidal self-injury. So even self-injurious behavior that's not with the intent to die, not with them without the intent to kill yourself, is a robust predictor of intentional suicidal behavior down the line. And so it's really important to think about all these different signs, acknowledging that what is significant for whom is different under certain conditions. And so Jen's going to talk a lot about how to use calm, curious, and empathic interpersonal skills to really set up your ability to ask directly about this important thing someone might be thinking about.
Thanks, Chris. That was very helpful. Just to be clear, we're not asking you all to memorize those multiple signs that we've put up there on the screen. The intent of our sharing those signs is to say that there are a lot of things that happen in people's past, trauma exposures. There are things that you can see, but the main thing is like really understanding when someone's off, when their behavior is different from what it usually is, or when someone has a major event, negative life event happen in their lives. Like it's incredibly important to check in with them using this step, this empathy and listening step. And so I want to propose here that a very key takeaway from today's presentation is that everybody, COVID-19 and what's happening across the country right now, everybody should be checking in with their loved ones using this step regarding how are they doing with respect to all the changes in their lives that have come from COVID-19. I mean, there is definitely not a young person in this country right now who has not been negatively impacted by COVID-19 in some way. Sure, some of our kids may have been thrilled. For example, I have 2 children. They were initially thrilled by the development that they'd be home from school, but now as they roll into week 4 of the interaction of homeschooling, the limited interaction of homeschooling, and the fact that they've lost many of the things that they love to do, it's getting old. I'm sure it's getting old for all of us. And so checking in around people, how everyone close to you is doing around COVID-19 is really important. And as Chris was indicating, if you see any of these signs, it's also a good time to check in. So let's talk about what it looks like to check in with people who may be struggling with COVID-19 or some other major event that's happened in their lives. And I want to cue you up to understanding the concepts we're getting at in this training by watching an important video by Brene Brown. She's a very well-respected social worker who's done a lot of work in the area of empathy and other important life skills. So take a couple of minutes to listen to Brene Brown and watch these very cute graphics.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." Yeah. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. At least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, "I don't even know what to say right now. I'm just so glad you told me." Because the truth is, rarely can a response make something better. What makes something better is connection.
So a lot of gratitude to Brene Brown for producing that video. One thing I want to say is that as parents, caregivers to people we love deeply, I think that empathy doesn't come easily sometimes, because one is we're kind of in it day to day with our kids in a very intense way, and so that's exhausting. But another piece I wanted to bring up is that we don't like to have our kids suffer, right? We don't want our kids to struggle. We don't want them to suffer. And as a result, I think we as parents will often jump to trying to solve their problems or to fix their situation, when in fact, that's actually, not only does that cut off an opportunity to develop life skills, but it can also really kind of impede communication, which builds connection, which is really critical to what we're getting at with this E-step. So let's take a minute to go back to our poll. And I'm going to ask you, based on that video and what you now understand empathy to be, which of these is an example of empathy? So choose one of these 4 options. Great. So you really are a very clever audience. Most people did say that mostly listening is what is empathy. And that's to say for folks who, the other things I think we often do these other 3 things, which are offering to fix the problem, asking a lot of why questions, offering our own perspectives when our kids are talking about their challenges. And it's not that these things are bad. And in fact, these may be relevant ways in which you interact with your kid as or your young person as you're developing solutions. But when you're really trying to form that connection, and particularly if you're gearing up because you're concerned about them, because you notice some signs and you want to be ready to ask them about suicide in a way that they're going to be ready to hear that question from you, it's really important to really focus on mostly listening. And so let's go on to the next slide, because this breaks it down a bit more. So what does it look like to give an empathetic response to someone? So again, it's mostly listening. A way that you can demonstrate that you're mostly listening is by reflecting back what they've shared. So I could say to my daughter, for example, "I hear that you're really, really frustrated that you can't play soccer right now." And then I'm not going to follow up and say, "But God, you're so much more lucky than the other kids in this world, because at least you have a home and a roof over your head." So that's not what you want to say. You want to listen, reflect back what they've shared, validate that emotion, even if, your daughter's kicking on the ground, your kid's kicking on the ground or screaming and yelling and having a temper tantrum. Acknowledge that emotion, let them have that opportunity to express that emotion, and trying to avoid judgment about the emotion that they're having, trying not to get freaked out by that emotion that they're having, and just staying neutral. So it's an interesting thing because it actually, in some ways, um, it means helping your kids is actually a lot easier in many ways than we think it is. We often think we have to solve all their problems, as the video said, but in reality, what we need to do is listen and validate their feelings. And yes, we may get to a place where we then become problem solvers, and in the learn steps, in fact, you'll see a clear transition where we do have to do some problem solving once we've identified if our youth is struggling to the degree that they might be thinking about suicide. But that said, it's just very, very important to form that connection. And again, I would encourage everyone to form that connection in this kind of way around the experiences your young people are having with COVID-19. So here are some things you could say. And actually, I'm going to ask my friend Chris to come on here, because this is, I think, more effectively done if somebody else reads the statements. So Chris, what could you say to me? I'm really scared about COVID-19. I honestly, I'm a single parent, and I'm worried even if I go outside that I'm going to infect myself and my kids, and then what will happen? What could you say to me, Chris?
Of course you're terrified. How could you not be? You do everything for your kids, everything you possibly can, and here we all are just stuck, not really knowing what to do at all, because no one's ever seen this before.
Yeah. Well, so that was really reassuring to me. That just communicated to me that Chris is listening, and he sees my situation. And so anyway, I think thank you, Chris, for sharing that. Chris, do you also want to read some of these other example statements?
Sure. So great examples here. It's okay to be scared or cranked up about coronavirus. Understand you're angry about social distancing. Tell me more. So glad you told me that you're feeling lonely. This is objectively miserable. I'm sorry you're dealing with this. Always a good one, because we can be sorry that people deal with things even if it's their own fault, right? We can be sorry for people who are miserable. Tell me more. I'm listening, and I love you no matter what.
Thanks, Chris. I love you no matter what.
Excellent.
Okay, so now I'm going to actually turn it back over to Chris to talk about, asking directly about suicide if you're seeing signs that concern you. And now you've formed that connection, and you're in a good place to actually have this conversation with your youth.
Yeah, once you've set up this experience of empathy, once you've connected with someone, then you can do some of this work that's a bit more directive. So empathy is all about calm, curious, supportive, non-judgmental, and that carries through into how you ask about suicide. But probably the biggest key that I bump into here is, like we talked about with some of that stuff earlier, is folks often have a very reasonable idea that if you ask someone about suicide, you're going to sort of put that idea in their mind. Like if I say, hey, are you thinking of hurting or killing yourself? Someone could be like, I wasn't thinking, but now that you bring it up, that's like the fear, and that fear makes total sense. There has been a ton of research done in this area. My friend Matt and I did a meta-analysis a few years ago where really there's no effect in terms of asking about suicide doesn't increase the risk of suicide or even psychological distress. And in fact, and this is the key for this step, asking about suicide is often asking someone, giving them permission to tell you the secret they haven't been able to tell anyone else, and is often an immense relief to folks who have been battling thoughts of wanting to hurt or kill themselves. And, right along with that, I'll point out that for all the ways that it makes sense to fear asking about this pretty difficult topic, it's also really important to recognize that folks will notice if you don't ask. So if it's a situation where it kind of makes sense to ask about risk of suicide, other, risks that might be at play, people notice when you don't ask and are negatively impacted by that just as much as they might be upset or offended or freaked out if you ask them directly about suicide. And I'll just point out that this work has been also done with trauma exposure and other sensitive questions. And there's these really beautiful experiments that were done a while ago where It's not asking about suicide or trauma experiences that gets people freaked out. If you want to really stress someone out and make them feel awful, ask them how much money they make. Like truly, this is like an empirical fact where they've done that experiment, and it's interesting what actually tends to make people upset. And it's not asking about some of these sensitive topics. So how to ask is just as simple as it is on the kind of the bubbles on the screen here. Really, really important to be direct. And I like the word on the slide here, which is courageous, which is to say, are you thinking of wanting to hurt or kill yourself? It's avoiding some of the ways that we might want to soften this up and say some of my favorites that I tend to hear when I work with people and their families is, you're not going to do anything stupid, are you? Or you're not thinking of killing yourself, are you? So those are examples of letting people know that it's really not okay to say if they're feeling suicidal. And then there's lots of things, again, that aren't totally unreasonable, but might lack the specificity, which are things like, are you going to hurt yourself? Are you going to hurt yourself on purpose versus are you going to hurt or kill yourself? I tend to say it that way because it's also important to help people, in addition to people who are suicidal, people who might be hurting themselves without the intent to die, who might also want to stop that behavior. In terms of when and how often to ask, this is a really important piece. If I ask you if you're going to kill yourself 17 times a day because I'm concerned about you and I care, not only could that be super obnoxious in a lot of ways, it could really, kind of put someone in a situation where they're just never going to tell you if they do have risk. And so some general ways to think about this. If you're noticing multiple warning signs, if that list of things to look for is kind of stacking up, then it makes sense to ask. And then the big piece here in the middle would be, are there noticeable changes, overt indicators that someone's in a little bit different space? This can be everything from, there's actually a growing amount of research that people who are more suicidal don't blink as much. And I'm not saying you should sit and count people's eye blinks. But I am saying that if you just notice that something's kind of off, if your spidey sense is tingling, that's real data that you can use to connect with someone. And that's a real signal that you might want to check in with someone, including asking directly about suicide risk. And then just to point out here, we've put it on the screen, is it's not just to do with has something changed in general. It's also having to now be in a situation that life has changed dramatically for pretty much every human in the whole world. And so it's kind of holding in context that there might be changes that are really due to coronavirus and not necessarily due to suicide risk, as well as it could be that coronavirus exacerbates other types of risk. And so it really is important to explore, what it is that matters. And the best way to do that is to ask directly. People won't do this out loud because we're not in the same room together. But I invite you to take a few minutes to think about how you would ask someone explicitly about this. And a nice format is the one that's up on the screen here. So, it's not wrong to say to someone directly, are you thinking of wanting to hurt or kill yourself? But that can be a little abrupt. And so one way to help someone feel like you've understood them, again, empathy, to help them see that you're not just thinking that they're randomly suicidal, but that there are reasons, that there's a situation that you understand, is to do something like, sometimes when people feel like they can't go outside, they can't talk to their friends at all, they can't do anything they want to do, they think about wanting to hurt or kill themselves. Are you thinking about wanting to hurt or kill yourself? This is a way, again, to just a very simple, concise, I see your situation, I'm tuned in, paying attention. Are you thinking of suicide? It really is a way to kind of organize this without getting lost in all the ways that the anxiety of thinking about this for someone you care about can really lead you down some, a lot of different directions and tangents. So there's a helpful list of things that come up for folks there that I encourage you to think about. However, if you go to the next slide, you can see that there's also this issue that, if they say no, that could be the end of it, but it's important to imagine this other step. It's important to imagine this sort of next piece here, which is not just to say, okay, you said no, you're not going to kill yourself. good news, right? If you ever did feel that way, who would you talk to about it? That's the next step you can take, which will, one, continues to send a very unambiguous message of care and concern. It also is scaffolding that if the signs that you saw are true and they are potentially increasing their risk, they might have those thoughts in the future. So you're helping them kind of cope in advance, think in advance, what could they do? Who could they talk to? You're also getting at this issue that comes up a lot where, frankly, people often respond in less than helpful ways when people say that they're suicidal. And so I work with a lot of folks, including adolescents, where it makes sense to me that they might not want to tell me they're suicidal until we've really built some trust. Or it might take a while to get to that, again, that deep, dark secret they haven't been able to tell anyone. And so this is also a way to help someone who's not ready to share that they're having suicidal thoughts. This is a way to help them think it through and imagine how they would get help and maybe do a little kind of problem solving, even if they're not ready to say it out loud. And then, of course, the other side of things here is if they say yes, we already talked about this, it sounds like a little, silly to some extent to say take it seriously. But again, take it seriously because we know that such a large proportion of people who ultimately die by suicide did tell someone in advance. I think really honoring what it means to share this, especially given that sometimes people don't respond super well, and to thank someone. And then to really be clear that this is not, this is anything but pleasant. This is anything but acceptable in terms of we don't want people to have to struggle with suicidal thoughts. We want to be helpful and supportive and help them get through whatever it is that has led to these kind of thoughts. So, I encourage you to think about, as we're all on listen only mode, how you would go about taking someone seriously, honoring and acknowledging what they've said. And then this other wrinkle here that's, especially important, I think when working with youth, or at least it comes up a lot for my adolescent cases. If someone says, hey, I'm going to tell you this, but don't tell anyone else, what would you say? What would you do? And so this really depends on who you are and where you are and what someone has said. So, if you're in some kind of professional context, usually you are stuck at least telling parents, right? That's important to make a parental notification. If you are in other professional settings, you may have to let other people know about it. Or it might be that you have the skills needed to manage the, situation as it is if it's a lower level kind of thought. But in general, what you want to do is communicate to someone whatever your limitations are around being able to keep that secret with them, being able to keep that confidence. And then if you can't keep the confidence, it's about letting them know you're in it together. And it's not that you're going to abandon them now that they've told you this important thing, this really important decision they're thinking through, but that you're going to help them figure it out together, even if that means needing to involve some other people. And we'll talk about who some of those people could be. In terms of some follow-up questions that are really important once you've gotten sort of that yes piece, which we don't have those at the moment, but yes, it's important to kind of think about if someone does say yes, that you're able to, help get them towards those next directions, including if they've said a specific way they might try and hurt or kill themselves. If they've brought up something in particular, you really want to do something to limit or remove the things that are going to be dangerous. And Jen is going to talk through this R step, which is how to help someone avoid dangerous items and situations.
Great, thanks, Chris. So with the context, so there are a couple of questions we want you to ask. Ask very important additional questions to ask your young person, that young person or whoever it is you're concerned about in your life. Those questions are, have you thought about how you might end your life? Do you have access to those means or those methods? Let's stay there for 1 minute. Thank you so much. So why might we ask these questions? The reason we're asking you to ask these questions is because the more detail that people have about these answers, like if they have a specific timeline, if they have specific methods in mind, generally speaking, that places them at even higher risk, and from a clinical perspective would potentially change kind of the range of next steps that you would pursue. But it's the more information you have about the situation, particularly if you're a trusted person, you are if you're able to have this conversation about suicide and someone shared with you that they're thinking about ending their life, by definition, you are a trusted person. And thus they're in a place where they can share some additional information that they have. Um, and also as a parent or as a caregiver, you have access to removing methods and means that they might have easy access to. And so that's another reason why getting at these questions is really important. Okay, so now I'm going to talk about some things that are relevant to, and this is in our remove the danger step, that are relevant if you have someone that you're worried about in your life who's suicidal. But generally speaking, I'm also going to be giving you a public safety message that's relevant for every single person on this phone, and frankly can lead you to take actions right after this webinar. So if I were interacting with you all in person, I would ask you the question, how many of you have medications in your home? And from what we know from research, undoubtedly probably about 85 to 95% of you would say you have medications. And when I say medications, I'm talking about prescription and over-the-counter medications. And I would guess that in households across the world, and definitely in this country, that now that number is probably closer to 100%. Because people have gone out and stockpiled on everything under the sun regarding medications. Also, as I mentioned earlier, people are trying, if they don't have COVID-19, to stay away from the healthcare system. So many people may be getting prescriptions in larger quantities without actually having to go into the clinic or to the healthcare setting. And so my guess is that actually the rates of medication ownership have even increased in this time. And so what I'm suggesting you all do is go online add into your online shopping list, if you don't already have one, some kind of safe or locking device. It doesn't have to be specific to medications, but there are specific medication locking devices. Here's the deal, like we know that kids can find stuff that we think are hidden. And so this is why kind of the up and out of the reach doesn't really work anymore in the context of talking about suicide, that old adage about how do you keep your home safe from medications. So locking up large quantities of prescription over-the-counter medications, which if they don't kill you from misusing them and overdosing on them, can cause you a lot of health challenges and will definitely in many cases necessitate a visit to the healthcare system. Also, we know that addiction, opioid crisis, most of that originated from our own medicine cabinets in many cases. So having easy access to medications in such a way that they could be misused is problematic. That said, we know that medication is also prescribed or used over the counter, and it can be very helpful in many different treatments for many things that we have in terms of physical and mental health. So we don't want to put a barrier to taking medication in the way it's intended to be taken. So if you have regular medications that you take, or if you have other people in your life who have regular medications, limit the supply that's available to a 1-week supply, and then just lock the rest of it up. So just really an important public health message. Also, if you've got expired medications, or after this COVID crisis is over, you've got excess medications that you want to get out of your house. We are very lucky in Washington state, and some other states are following the lead here, to have drug disposal much more widely accessible. And so just like you take out the recycling or gather your recycling, I think we've got to get into this routine in a routine way of taking back your meds. And so some really important messages around medication safety that are really important to suicide prevention. One other thing I wanted to say here is that if you've got someone in your house who's already taking a medication for mental health challenges, again, we're going to all be checking in with our loved ones using the skills around empathy that we've been talking about. But it might be a good time, if you're even more concerned about that person who's taking those regular medications for mental health, to make sure that you're involved in helping them take those medications as they were prescribed, just for this period of time when you're particularly worried about them. This includes some older adults as well. And of course, there's some challenges posed by that with social distancing. But I think you can kind of get where I'm headed to here, that we need to make sure that those of us who are struggling have some extra protection around not misusing medications during this time. The same kind of messaging that I've been talking to you about, the same kind of public health message I just gave you all, is absolutely 100% relevant to firearms as well. We know that um, roughly half of all suicides in this country, including for youth, a little bit lower for youth of a percentage, but we know that roughly half of all suicides in this country, firearms are the method that's used. And that's not because firearms themselves cause suicide, it's because they are easy, readily accessible in a lot of households. And they're often purchased for home defense. And so they're really easily accessible because people think that they're going to face an intrusion or some other issue that concerns them regarding home defense. And so we have easy access to firearms in a lot of households. And what people don't realize is that most people don't realize that the majority of firearm fatalities are suicides. So it is definitely much more likely that your firearm is going to be used in suicide than it is going to be used to defend yourself against homicide. That's just the facts. It's definitely not an anti-gun message. It's about, look, we need to educate people that a key component of firearms safety has to be about firearms access and has to be about suicide prevention. So we recommend that all firearms, including those used for home defense, are locked up or secured, locked up and secured. And for those of you who have a firearm for home defense, you might be saying, well, duh, what's the purpose of having a home defense firearm if it's locked up or not easy to get to? And so there are fast access locking devices that are available to purchase online. Now would be a really great time to go out and get a fast access locking device that only limits you to accessing that firearm. Youth should not have unsupervised or unauthorized access to firearms during this time, or frankly, at all. Many youth participate with their parents in the use of firearms, but it's very important to not have unsupervised and unauthorized access. If you yourself are struggling, or you think a friend of yours or your partner or someone in your life who owns a firearm is struggling, it's incredibly important to take steps to limit their access to firearms during this time. There's a couple of different ways you can do that. You can give a friend or a relative the keys and combinations to your locked up firearm so that you don't have access to it. You can also do, in the state of Washington, an emergency temporary transfer of a firearm. So giving someone else the firearm in an emergency temporary transfer. So again, with social distancing, there might be some challenges to this, and especially because that emergency temporary transfer could be especially challenging in this time. But the point I'm trying to make here is, if someone you know who owns a firearm is in a crisis, it's very, very important to limit their access to firearms. And it could be that maybe even you remove the ammunition, or you put the gun on ice, anything to limit access. Because when people have easy access to methods of suicide when they're in crisis, it's a little bit like having ice cream in the freezer when you're on a diet. I mean, it's incredibly hard, makes it even harder to not have those thoughts and feelings. So incredibly important that we think about this piece, and we can be proactive about it. It just limit the risk by taking steps around medication and firearm safety. Wow, I'm getting a very pasty mouth at this moment, which means I'm talking too much. So I'll go on. Okay, so what really needs to happen? And this is today, we just talked about firearms, prescription medications, and over-the-counter medications, limiting access and locking up and securing. And then if you've got someone who you affirmatively know is in a crisis, we've asked them about suicide. It would be advised to also lock up these additional items on the screen: alcohol and drugs, belts, ropes, plastic bags, knives, sharps, car keys, chemicals, pesticides. The truth is that people who are thinking about suicide, they'll oftentimes fixate on a specific method. And if you can put time and distance between that method that they're considering using to end their lives and give them a chance to kind of work through their suicidal ideation and feelings and just try to get at some of the underlying stuff that's causing them to have those feelings, that ultimately, if you can put time and distance between those means and the action of suicide, that you can really save a lot of lives. People sometimes will substitute methods if they don't have access to one, but again, that people are so often so depressed and unable to really make decisions when they're suicidal. So switching methods is even a really challenging thing for people to do. And so again, there's proactive things we can do today. Right after you get off this call, I would hope that most of you would be out ordering online locking devices for meds and firearms if you don't already have one. And then again, if you're in crisis, got someone in your life in crisis, think more holistically about means that are easily available. And now I'm going to turn it back over to Chris, who's going to talk about the last step in Learn, which is next steps.
Excellent. So once you've gone through these steps, once you have identified signs that have sent you down this track of being calm, curious, and empathic to ask a question that occasions some removing of dangerous objects and situations, it is important to think about, what are you going to do next for this person? What are you going to do next to help someone you love, someone you care about, navigate suicidality? There's kind of the pivot here, which is Jen has described those things you can do to limit and remove access to dangerous items. That's a very straightforward way to help someone stay safe long enough to get some kind of follow-up treatment. It's a bit more complicated to kind of resolve or unravel someone's suicidal thoughts. The good news is it's not as complicated as you might imagine, and there are some treatments that exist, including one that I do a lot of, where in as few as 4 sessions, you can have someone go from very suicidal, really wishing that they would die, to not being suicidal at all, to resolving that suicidality. And so there's a tremendous amount of hope if you can loop someone into those next steps. And so, one of the basic resources that's super helpful for anyone, if we go to the next slide, is the Suicide Prevention Lifeline. This is an excellent resource for the reason that it's always available. You can call this number 24 hours a day, 7 days a week, every day of the year. And there's some wonderful studies from Madeline Gould and colleagues who are part of the leadership for this resource that show even in that one phone call, even if you phone the Lifeline anonymously, talking to someone you don't know, have never met, will never meet, maybe even in a different state, you will feel better after that one phone call. And feel better means you'll be less distressed, you'll be happy about how things went, and you'll rate your suicidality at a lower level on average. The other nice thing about the Suicide Prevention Lifeline is when you call this number, whether someone is feeling, kind of more in that category of very upset and not especially suicidal, or actively suicidal, they've got the skills and the resources to help with that. And so even if someone does need a rescue, if they need, emergency services to come see them, the Crisis Lifeline can help orchestrate that. They can help coordinate this resource. So they really are a one-stop shop. And you can also see listed here the crisis text line, which, there's emerging data showing that this is an excellent resource in the same way as the telephone line, but it's a newer thing and might even be preferable for lots of populations, including youth. And they also encourage everyone I work with that it is the Suicide Prevention Lifeline, but it's also the I'm very upset at 3 a.m. on a Saturday and don't want to call anyone I know lifeline. So it can be a resource for any level of distress, and I encourage folks to make use of that and to share that with people in your life. Some other resources that could be useful. So the Suicide Lifeline does link directly to the Veterans Crisis Line. For those who are HBO people, there was a really compelling documentary for the Veterans Crisis Lifeline that gives you a pretty direct sense of what that's like. So if you're curious about what a lifeline looks like behind the scenes, I commend that documentary to you. And you can also see how straightforward it often is to connect with and help someone over the phone. Some other specific resources that are listed here, and this will be available for folks later, just to point out that there are a bunch of different Lifeline-like resources, and as well as resources specific to experiences like sexual assault or domestic violence, and even resources for addiction or coping in the aftermath of some kind of catastrophe, or in the setting of eating disorder, that all have specific resources. And for the resources listed on this page, sometimes having a little bit more expertise in these content areas or clinical expertise can be meaningful. And so we wanted to share those with you. And then just to point out here, this is a growing part of the experiences that people are having. You know, not a lot is known. People are still working to understand this issue about social media. But it's increasingly, you know, the case that people will broadcast their distress to like the whole world. It's increasingly the case that people will put up an explicit threat of suicide. And I have worked with patients, and perhaps you have seen in the lives of your children or their friends, that people will even do this thing that's not meant to be serious, but gets your attention, where they'll say, you know, 50 people respond to this post, or I'm going to kill myself. This whole range of communication is very difficult to cope with because, again, referencing back to the things we've talked about already, it has to be taken seriously. It has to be something that is addressed directly. And it can be challenging because it really starts to change the meaning of a suicidal communication, in that now everyone in their social network potentially knows. And it also has this quality of potentially being unintentionally reinforced by other people trying to care. And so just as you can see is listed here, if you do see concerning content, please make use of the tools that exist to report that, because we want to participate in efforts from social media companies to manage this. Again, taking it seriously, use the learn steps. And then every platform has sort of their own thing that they do, including various levels of active intervention or helping choreograph rescue. Again, it's a objectively challenging thing because there are, you know, however many millions and millions of social media postings, communications at any given moment. But it's something to take seriously and play a part using the steps we've talked about.
Let me jump in here on this one, Chris. So here, what we're going to do is, at this point, put all the steps that we've been talking about. Chris and I have been talking about the L, the E, the A, the R, and the N step. We put them all together in this video vignette that you're going to see. It's a fictional vignette, but yet I think you can see, you know, what we've been talking about really kind of illustrated quite clearly here. So I'd encourage you, as you watch this video, to think about it in your mind. What was the L step? What did you see that was the L step? What did you see that was the E step? What did you see that was the A step? What did you see that was the R step? What did you see that was the N step? And so that you can really reinforce in your mind those 5 steps that we talked about today. And again, this video isn't necessarily the perfect interaction. And I kind of like it for that reason, because what we're not trying to say to you is, we're not trying to say that your interactions around this challenging topic have to be perfect. They just have to be sincere. And so, you know, but we're here to give you guidance about how to intervene if you are concerned about someone. So take a few minutes to watch this video and think about L, E, A, R, and N.
Hey, Danila, can we talk for a minute?
Sure, what's up?
Well, it's been a while since we've talked, just the two of us.
Yeah, I've been pretty busy with midterms right now.
Right. I was thinking about how much you missed your dad since he's been in Iraq. You had that panic attack at school. You've been spending a lot of time in your room, not hanging out with your friends. Is everything okay?
Yeah, I try not to think about my dad. It's too depressing. And the school drama is really getting to me.
I'm sorry. I didn't realize things were bad at school, too.
Yeah, people complain about their parents. I just don't get it. And I can't help thinking what bad could happen to my dad while he's over there.
Right. You've got a lot going on. Your dad can't be here with you, and you're worried that he's okay. It sounds like the stress at school just keeps piling up. maybe we should talk to your school counselor.
No, I don't want anybody to know. I don't need people feeling sorry for me just because I'm going through a hard time.
I can see you're really upset and anxious. Sometimes when people feel this helpless and alone, they're thinking about suicide. Are you thinking about suicide?
I'm just tired of hearing about other people's problems. And nothing I say or do makes a difference. I just figured nobody would notice if I was at school.
It sounds like things have gotten really bad, especially when you say no one would notice if you were gone. I think we can get through this if we work together.
I don't know.
Danila, have you been thinking about suicide?
Really, I'm fine. Don't need to worry.
Danila, look at me.
Okay, I have. I'm sorry.
You don't need to be sorry. I'm so glad you told me. Have you thought about how you might end your life?
Not really. It just keeps popping in my head.
I can see you're in a lot of pain. I'm so glad you told me. I don't know what our next steps are, but I just learned about the Lifeline, and I think now might be a good time to call them.
I guess.
I think you should have someone you can talk to at school, too. This isn't something we can ignore or try to solve on our own. Who do you know at school that you could talk to?
Well, my health teacher, she knows that I'm stressed and going through a hard time.
That's great. Having people to talk to will give us more strategies and help you to feel less alone. I can tell this wasn't easy.
Yeah, I just didn't want to make a big deal out of it. I'm trying to be strong and get through it on my own.
You don't have to ever be alone. You're so precious and I love you.
So did you all see it? Did you all see the steps, the L, the E, the A, the R, and the N? What I really liked about that video in particular was that I felt like that empathy was illustrated throughout the entire interaction and was used to get that honest response very effectively. And you saw how she framed that question about suicide in terms of some of the warning signs that she was hearing, and that was that multiple warning signs that were being revealed in that conversation that ultimately drove her to ask that question. And she didn't freak out when she finally got that yes question. She was tried to stay really calm. And I really loved when she said, you know, I don't exactly know what all the right steps are, but we'll get through this together. And I think that just really was a very sincere, and very sincere way to feel and to know that they're both vulnerable at this time and they're going to get through it together. So, okay, so we're coming towards the end of our program. So based on what you've heard today, I'd like you to look at this polling question and think about which of these things could you possibly do today based on what you've heard. So let's look at what you said. So say die by suicide. So very encouraging that 61% indicated that they could possibly try to shift on that. And this will be a work in progress. Oftentimes people who are just learning on shifting their language, they slip up and say, and who are trying to change their language will slip up and say committed suicide. And so I think it's just a really great thing to kind of be open to learning to change our language about this very important topic. Let's see, about reaching out to someone in distress. That is very encouraging that 71% of you are saying that you think you might be able to use what you've learned today to reach out to someone in distress. Honestly, I think this could be 100%. It may be that you don't actually feel like anyone in your life is in distress at this moment. But again, I think some of the skills we've talked about today, particularly around being vigilant, around warning signs, and the E step, are relevant really to everyone. I would definitely encourage everyone to put the National Suicide Prevention Lifeline and the crisis text line into your cell phone, so you have that easily accessible to you at any time. We'll make sure that those resources are part of the information that you receive after the webinar. And I'm thrilled to see that many of you think that you have steps that you can take to make your own home safer to prevent suicide by limiting access and locking up and securing medications and firearms. So thank you for sharing what you plan to do.
And I want to thank Forefront and our other collaborators who've been participating today. We want to make sure you all know how to reach out to us. So we've got some information here in this slide, and we will also be posting those links in the chat if you want to reach out to us. And again, just a reminder of the Wellbeing series. So use the link to get to the Wellbeing website. We have some meetings later today that we're going to be adding some additional trainings, and we are continuing to add opportunities there. So we appreciate your patience and your grace as we quickly try to respond to the needs. But you'll be able to find all the registration links there, all the recordings. If things fill up, be reassured that we're going to work very quickly to post videos and presentations just as quick as we can. If you have any additional questions about the Wellbeing series, you can reach out to Meg and Lucy.